It is Thursday. It is 1:30 in the afternoon, Eastern Standard Time, here in Ithaca, New York, here at C-Change Family Chiropractic. And everybody knows, or at least everyone in this room knows, that when we hit 1:30 on a Thursday afternoon here in Ithaca at C-Change Family Chiropractic, that it's time to go live on Facebook. And we're talking about topics that we've been talking about here in the practice, news out in, in the world, in our community, that is relevant to you or somebody that you know, so therefore it's relevant to you. So just to step back and say it is Thursday, 1:30 in the afternoon here at C-Change Family Chiropractic here in Ithaca, New York, and we're on Facebook Live. If you haven't already liked us on Facebook, I'm going to encourage you to do that now, because you'll get notifications every week knowing that what the topic is that we're going to talk about. And if you haven't subscribed to our YouTube channel yet, please do that as well, because we will upload this video up onto YouTube if that's your preferred viewing method. So this week we are going to talk about the state of Ohio, which we all know when it comes to presidential elections is a swing state. And so that's why I cleverly titled this week's Facebook Live episode or video about Ohio being a bellwether state, really a predictor of what's going to happen. And before I talk about Ohio, I want to talk about Washington State, because a couple years ago there was a study done by Washington State for their Workers' Compensation Board to see what happened when people went out of work with low back injuries. And what they found was if people went to the chiropractor first, about 1.5% of people, it was 1.7% of, I think it was 1.5% of people who saw a chiropractor ended up needing low back surgery. So, you know, some people, just like in my office, I've been in practice about 9 years here. There have been a handful of people, about I think 3 people in 9 years, that I've had to refer to the neurosurgeon who ended up getting, back surgery. It happens. So 1.5% of people who saw the chiropractor first ended up having surgery. If they saw the orthopedist or the neurosurgeon first, 42.7% ended up having surgery. That's about 30 times higher rate. And what we know is, while there are some people that need low back surgery, it's not 30 times the amount than the ones that are getting it if they see a chiropractor. So there's a lot of times where surgery is not necessary and people have great results under chiropractic care. And Washington State published a study showing, yeah, people saw the chiropractor first, they basically didn't end up getting surgery, and they were able to return back to work. So that was a couple years ago. Just this last month, or maybe in the last 2 months, Ohio, their Workers' Compensation Board, put out a rule that before anyone can have low back surgery, the exception being if it's traumatic, obviously, like forklift falls over on you, you rupture a disc, you have a potential spinal cord injury, yeah, that's a traumatic event, and sometimes immediate surgery is necessary. But outside of those, crazy trauma events, their rule is until you've tried chiropractic and or physical therapy, you can't get low back surgery. And the reason they're doing this is because they're finding, A, there's a lot of surgeries that are being done that are not necessary. B, particularly when it comes to like multi-level spinal fusion, two-level spinal fusion, the effective rate, and I'll put up, the study, I can't remember where it was published, but might be in the Spine Journal. Anyway, 27% effective rate after 5 years. So what they're finding is even when people get some relief initially, the 5-year outcomes are really poor for that surgery. So if it can be avoided, we want to avoid it. It doesn't mean that nobody should get it. It means that if we can avoid it, we want to avoid it, because costs are way down if we can avoid low back surgery, and costs of physical therapy and chiropractic care are small percentages compared to injections, surgery, and post-surgical disability. So Ohio put out this ruling just in the last month or two. Got to, if you're going to get if you're going to get low back surgery through workers' compensation, you're going to have to go see the chiropractor and or physical therapist first before we can approve it. And this is a really great sign for not just the workers' comp folks in Ohio, but we're starting to see it elsewhere. Maybe next week I'll talk about this. We also saw it in, I think, West Virginia is the other state where before people can get low back surgery that's non-traumatic, have to do a conservative course of care, which means chiropractic care and/or physical therapy. And like I said, it doesn't mean that nobody needs low back surgery. You know, I consider myself a highly skilled practitioner, and some people just don't get better doing what we do here. The good news is I think it's been 3 or 4 people in 9 years. And, you know, those 3 or 4 people were at a place where things had advanced too far to where we could make a noticeable difference. Maybe we made 10, 20% improvement, but that's not significant enough, and their lifestyle was still significantly affected. And even post-surgically, they were not able to return back to 100%, but they really did need surgery. So, you know, that's to say that surgery is necessary at times, but most of the time it can be avoided. And the other thing is, and if you ask any surgeon, whether it's a thoracic surgeon or, you know, any orthopedist who does hip replacement, the best predictor of how someone is going to recover and perform post-surgery is what kind of shape they were going into surgery. So even the folks that require surgery, you know, whether it be in Ohio with their workers' comp folks, they are going to have better results with their surgery having undergone a course of chiropractic care prior to it. Because if you think about it, if you're non-functional, if you've got spinal dysfunction and poor alignment, and then you're going to put pins in or fixate or create a lot of scar tissue in that area, you're going to compound the problem. Whereas if you have functional tissue and then you have surgery, you're going to respond faster, better, and have fuller range of motion, greater strength, flexibility, and better outcomes over the long term. So Ohio may be a bellwether politically, but it certainly is going to be a bellwether in terms of treatment of low back pain. And the other thing, you know, the canary in the coal mine, I think is the expression, is that, you know, we have this huge opioid crisis in this country. And a huge part of that is treating chronic pain, chronic low back pain. And so same thing, when people utilize chiropractic care, again, and/or physical therapy, there's less opioid prescription use, and we're going to see, really a turning of the tide if we can put our focus, and particularly, like, you know, healthcare policy always helps because that's going to be a guiding force. But then, of course, it's up to us as individuals to make these decisions for ourselves. And it's up to, even if this is not something that affects you personally, almost everyone here, either if they're not affected personally by chronic low back pain, they have somebody in their life that does, whether it's their father, their mother, their sister, their coworker, their boss, their neighbor, somebody in almost everybody at this point in this country, almost everybody is affected in some way, whether it's them as an individual or someone close to them by this. And we don't want to see them have a lifetime of addiction and disability. So that's where we are really the forerunners in changing that tide when we are able to partner with the public in making those choices. So I'll post some of those links that I was talking about here. I always want to hear your questions. You know, we're talking about things that we're talking about here in the office, what we talk about out in the community, and in this case, healthcare policy in other states, but what we're going to see is that happening across more states in this country and at some point nationally. And that'll help drive down healthcare costs so that we can get better healthcare more affordably. So post your questions here, post your comments here, follow us on YouTube, or subscribe to us on YouTube. I guess I'm not on Twitter. Maybe I will be someday, I don't know, but like us on Facebook, and we'll look forward to seeing you next week.